Hello, good morning, dear friends. This is Dr. Jambukeswaran, PrepLadder's Orthopedic faculty for you. Do anyone in the line? Can I get in the chat box? The chat box, anybody? Okay, Abhishek Kaushik, yes. Yes, Aditya Mahavar, yes sir. Okay, Aditya, yeah. I think I am visible and audible clearly. Okay, so we will straight away directly go with the session. Okay, we will go to the first question. A 20-year-old male presented with localized pain with gradual in onset and worsened over time. X-ray showed the following finding. Which is the diagnosis? See, this is, first of all, I need your help to look at this X-ray and tell, is this the X-ray they had given in the exam? Because the lesion here, according to this X-ray, lesion is in the diaphysis. If this is a diaphyseal tumor, the answer should be Ewing sarcoma. But a more common tumor, the lesion should be in the metaphysis. If it is in the metaphysis, then the answer should be osteogenic sarcoma. I need your help. Was it given here or in the metaphysis? Kindly type. Only a description with sunburst appearance, sir. Okay, Amarul has given Abhishek X-ray. Yes, sir. No image. Yes. Only a description with sunburst. Okay, they had used the word, yeah, sun ray appearance question. Yes, sunburst appearance. When sunburst appearance is the answer, when sunburst is the, whenever they had given the word sunburst, okay, there is no doubt, the answer should be osteogenic sarcoma. Osteogenic sarcoma. Okay, no image. Now I got it from your feedback. Image was not given. They had given a description of sunburst appearance. Straightforward. The answer is osteogenic sarcoma. Very good. I hope all of you would have done excellently. Okay. Very straightforward. Many times we have discussed this in our live sessions. We have discussed, it is there in our recording. So it will be easy for you. Okay. Excellent, Mukesh. Everybody has answered it. Marvelous, man. We will move on to the second question. Which nerve will be involved in the following finding? So, when you see this image, just clawing of your little finger and the ring finger, this is the pure ulnar claw hand. This is a pure ulnar claw hand. According to this picture, the nerve that should be involved is ulnar nerve. That should be the right answer. If it is associated median nerve, all the fingers will be clawed. It is called total claw hand. But this is called an ulnar claw hand. So, straightforward answer, it should be an ulnar nerve injury. All of you, yes. Raj has given the thing. Yes, Raj, everybody is answering. Excellent. So, ulnar nerve. Marvelous, man. So, this is again a straightforward hit. All of you would have done well. Okay, thank God. The third thing, identify the instrument. Okay, they had given an instrument like this. This is called BB splint. This is called a BB splint. BB stands for Bowler-Braun splint. Stands for Bowler-Braun splint. Okay, so this is called BB splint, Bowler-Braun splint. Where this is used? You see, for example, somebody has developed a hip dislocation or fracture shaft of femur. Patient is lying here. I am putting a skeletal traction. It is tied to this and a weight is given here. A weight is given. Okay, this you would have seen several times in the ward. So, this is done for skeletal traction. This splint is done for skeletal traction. This is called Bowler-Braun splint, BB splint. Okay. So, this is totally different. Thomas splint, it is ring like shaped splint, tapering ends, that is to immobilize femur or tibia, lower limb, that is different. Workman splint is a small one, that is for your upper limb, Workman's ischemic contracture. Okay, so Kramer wire is totally different. So, this is a Bowler-Braun splint. Okay, good. And a 30-year-old met with accident and presented with the following findings. When I see this affected hip, hip is flexed, okay, it is flexed, abducted, externally rotated. Flexion, abduction, external rotation. It should be a case of anterior dislocation hip. It should be a case of anterior dislocation. Anybody is there? Is this the picture, everything given in the exam is correct? No image, no question. This question was not present in the exam. They had given to me in the recall session. Did they give any description like this? Flexion, abduction, external rotation, any word like that? Yeah, question, shoulder, yeah, shoulder dislocation is coming. Shoulder dislocation is coming. Okay, there was. Amrul has given there was. Okay, yes, image given for anterior dislocation. Yes, yes, yes. Shoulder dislocation is there, that is a separate question. So, if this is there, this should be flexion, abduction, external rotation should be a anterior dislocation hip. If it is flexion, adduction, internal rotation, then it should be a posterior dislocation hip. We will move on to the next. A 7-year-old child was brought with bow legs and X-ray of the wrist. Following findings were seen. Okay, so 7-year-old child presented with bow leg, that is genu varum. The commonest cause for genu varum in a child in our country should be rickets, and the X-ray given, no, you see this, when I see this X-ray of the wrist joint, I am able to see cupping, I am able to see splaying, widening, and some irregularities there. This is called fraying. I am seeing a cupping, splaying and fraying. So, classically that should be a case of rickets. That should be a case of rickets. Okay. Yes, leg image. Okay. Only leg, bow leg image, only bow leg image. Whenever, so the commonest, even if they had given an image of a bow leg like this, image of a bow leg like this, then the commonest cause for genu varum bow leg in a 7-year-old child in our country, again the answer is rickets. It should be vitamin D deficiency. Vitamin D deficiency. Okay. Yes. Now we will move on to this. What is this fracture in the skull? This is a depressed fracture. This is a depressed fracture of the skull. Okay, depressed fracture. This is sometimes, yeah, many have answered yes. Aman, Medhi, Mahavar, Aditya Mahavar. Yes, everybody has answered. It's very good, man. Excellent, excellent. So, this is a depressed fracture. This goes by another name also, which is called pond fracture. Okay, depressed fracture is otherwise called pond fracture. Okay, good. So, marvelous, marvelous. Now, a 23-year-old male epileptic. See, I want to confirm this. In this shoulder case, did they use the word epileptic? Did they use the word epileptic? Vikrant, Mohini Pawar, did they ask any? She's telling that achondroplasia question was there. I didn't get the question. Did they give any image of achondroplasia? Okay. So, the shoulder dislocation examination revealed right upper limb in adduction and internal rotation. If the shoulder dislocation, I do not know what question they had asked, I will tell you the explanation. If the shoulder is adducted and internally rotated like this, it should be posterior shoulder dislocation. If it is abduction, external rotation, then that should be anterior shoulder dislocation. What they had asked, adduction, internal rotation or abduction, external rotation? Shoulder dislocation with abduction, external rotation was given. FMGE aspirant has given abduction, external. Vikrant also. If it is abduction and external rotation, directly the answer is anterior shoulder dislocation. Answer is anterior shoulder dislocation. Alright. So, anterior shoulder dislocation, subglenoid, there is a type, anterior shoulder dislocation. The answer should be anterior. Yes. Abduction, external rotation. Sir, it was inferior in X-ray. Inferior in X-ray. If it is inferior in X-ray, the humeral shaft should go like this. The humeral shaft should be like this. Then that is called luxatio erecta. If the image it is like that, then that should be, this is called salute position. This is called salute position. Okay, what was the image they had given? Anterior shoulder dislocation photo was there. Okay, only X-ray with anterior dislocation. Okay, then if it is, yes, if it is they had given very clearly, then the answer should be anterior shoulder dislocation. Yes, a 42-year-old woman laborer presented with visible soft tissue fluctuation swelling in front of the knee. Okay, so a cystic as a fluctuant swelling in front of the knee, it's called prepatellar bursitis. It's called prepatellar bursitis. So the prepatellar bursitis is called housemaid's knee. Okay, prepatellar bursitis is called housemaid's knee. Okay, prepatellar bursa, yes. Injumal Hue and Tejasvi, yes. No woman laborer question was given, only carpenter. Okay, carpenter, but they had used the word carpenter. Did they use anything called soft fluctuating mass in front of the knee? If that word was there. Hey, somebody is telling carpenter, somebody is spelling painter. Carpenter history with prepatellar bursa. Yes, carpenter history. It is not telling a laborer, woman laborer. It is carpenter with prepatellar swelling, which is called prepatellar bursitis. That's called housemaid's knee. That's called housemaid's knee. You know, prepatellar bursitis is called housemaid's knee. Infrapatellar bursitis is called clergyman's knee. Okay, so it should be yes. So it is a case something. The answer should be housemaid's knee. Okay, these are the questions which I have got. And I hope guys, so far the questions which we had seen, okay, all are already discussed things, and majority of you would have done really well. And you FMGE guys, okay, you are my favorite always. We are very close and we were working together for a period of roughly 1 year. Okay, so I pray sincerely to God that all of you will get through. There is no doubt. Okay, we are with you. My sincere prayers, all of you will get through, don't worry. Okay, so if God's wish is there, we will meet in person, okay, as my house surgeons. Thank you so much, dear guys. Thank you so much.